Hello everybody! Today I'm going to talk about infusion days. The reason why I'm choosing today to talk about infusion day is because today is infusion day for me. I have dysautonomia, Ehlers-Danlos syndrome, also known as EDS, mast cell activation syndrome, and the type of dysautonomia that I have is called POTS. And POTS causes me to be very dizzy and faint frequently, especially when I am upright, like standing. But even sitting for long periods of time can do it too. One of the best treatments for POTS and dysautonomia, both as a preventative treatment, so to prevent flares from happening, which is what we do in my case, and also to treat flares, which is why some people with dysautonomia go to the ER to get an IV. You can see an experience of me going to the ER to get an IV in my convulsive syncope ER visit video. I was surprised when that one got quite a bit of views. I didn't expect that, but so yeah, today is infusion day, and I think a lot of people with chronic illness have mixed emotions about infusion day. So I can't speak for everybody. My hair is so messy. I can't speak for everybody, but for me, infusion day is both a relief and a nuisance. The reason why it's a nuisance is I don't enjoy being hooked up to a pole for 8 hours. Even though I am chronically ill, I still enjoy being able to walk around my house and go to the bathroom without carrying either an IV bag above my head like this and then putting it on a nail on the wall, or just carrying the whole pole with me. It makes getting stuff like going to the bathroom or getting food or water very annoying. I'm very lucky that I'm able to do those things. The reason why it's a relief is because infusions, saline infusions, they just are so life-changing for people like me. A lot of times when I am starting to get up to my next IV infusion day, I start to feel really crummy, and I know that that's because my last IV is wearing out and I need a new one. So I personally get them 2 times a month. Some people get them once a month, some people get them once a week, some people get them a few times a week, some people get them every day. It depends. It depends on a lot of things. For one thing, it depends on like the severity of your symptoms, and I guess that's the main thing. And also like doctors, because even though this is like one of the best treatments for dysautonomia, since doctors are often not educated on it, and even if they are educated on dysautonomia, IV treatments are very controversial amongst doctors. And the reason for that is they don't want us to become dependent on the IV. Now, what a lot of us would say in response to them not wanting us to become dependent on the IV is, we already are. You know, if you're sick, you need treatment. So if I'm sick and having an IV improves my quality of life, I think that already means I'm already dependent on treatment, even if I haven't been doing the treatment. So we might as well do everything we can to improve chronically ill people's chronic quality of life. Sorry, brain fog. And I think that's really what the IV infusions for me is all about, is improving quality of life. I am extremely fortunate that I'm able to get this treatment, and it might seem quite simple. I mean, it's just an IV. Like, why would that be a big deal? But it's because some doctors don't agree with it, and some doctors just aren't educated on it, and it's hard to find a doctor who is educated on dysautonomia and who is supportive of IV treatment. I have both of those things. My doctors are amazing. Even though it took me 5 years of being very sick before I got diagnosed, I have been very fortunate, like extremely. And people are flying literally all over the country to see my doctors. And they're just like 30 minutes away from me. It's something I'm so grateful for. I would show you my IV bag because I don't know, some people find that interesting for some reason. But I don't want to move my camera. I can show you my IV thing here. I know that freaks some people out. So, close your eyes when I tell you to, and then I'll count to 3 and you can open them again if you don't want to see it because it freaks you out. Okay. Close your eyes. Okay. 1, 2, 3. Okay. You can open your eyes again. But yeah. Mixed feelings about this because I always start like celebrating whenever I take it out because I take it out myself. They allow me to do that, by the way. They gave me the option of having a nurse come back to do it, but it's really not that hard. I always celebrate whenever we take it out at the end of the day because I'm like, I'm free. I'm not connected to a tube anymore. And something else I wanted to talk about is why do I do it over 8 hours? That's a long time. Okay, so for one thing, I have 2 bags. Usually 1 bag would be over 2 hours, so 2 bags would be over 4 hours. That's what I started doing at the beginning. But then I realized that I was having some like side effects the next day, being very fatigued. And the reason for that is because our theory behind that, or our hypothesis behind that, is that my body is running on adrenaline all the time. And so once it finally gets what it needs to function, it just like, oh, I can finally relax. So that explains why I sometimes get very fatigued the day after. The fatigue the day after is worth it because then the next day and the following days, it's a lot better. But what helped the fatigue was doing it more often, so 2 times a month instead of once a month, and also spreading it out over 8 hours instead of over 4 hours. Another reason why doing it over 8 hours is better for me personally is the slower you do an IV, the more your body is able to absorb it and use it. Oh, sorry, I'm getting frustrated just thinking about this. One of the most annoying things that I hear and that I've experienced is POTS patients in a flare and they go to the ER for an IV, and I understand because, you know, most people don't really know about it, and I understand that the workers want to get people in and out really quick as they can, but they'll attach a POTS patient to an IV and put it on as fast as they can so they can get the POTS patient out really quickly. The problem with that is if you do it really fast, it either doesn't help as much, only helps a little bit, or sometimes doesn't even help at all if you do it fast because your body does not have enough time to absorb it. And so, even though doing it over 8 hours is a nuisance, it's worth it. So, yay for IV days, infusion days, and also I'm excited to not be attached to a pole later today. And I'm realizing I should have said this at the beginning. What is in my saline bags, what is in my IV bags is literally just water and sodium. It's literally just fluids. There's no like medication in it. And so the reason why that helps is because it fills up my blood volume. And if you have more blood circulating your body, you're less likely to pass out, because even if a POTS patient doesn't, like, actually have low blood volume because of the way it drains from our upper body into our legs. Our bodies behave as if they have low blood volume. So a lot of patients do have low blood volume. Some don't, but our bodies still behave that way because of the way our blood doesn't circulate. So more blood equals more circulation equals less dizziness, less fainting, less symptoms. Yeah. And also POTS patients, one of the most difficult things is staying hydrated. So that's another reason why I get IVs. I was going to try to make this video short. Apparently, I like to talk for 10 minutes straight. Thank you for being here. And if you have any questions or comments, put in the comments. What are your experiences with IV infusions? Or if you haven't had any experience with IV infusions, do you know anybody who has? Or what are your thoughts? Are you confused? Are you shocked that a nurse would come to a seemingly healthy looking person's house and stick a needle in them and have an IV pole in their bedroom? Just yeah. So thank you, and see you later.